My life and health before undergoing the procedure was quite hard. I was tired all the time. All I wanted to do was sleep. Every time I went to the doctor, of course it was a struggle even to get out of bed because my blood pressure was so extremely high for years.
Some people have hypertension that's fairly easy to control with 1 or 2 medications, but some people's blood pressure is very difficult to control, can require 4, 5, 6 medications. So this is mainly for people who have more difficult to control hypertension, or in some circumstances, people who just have a side effect to every medication and they're just trying to get on less medication. Symplicity procedure is a procedure that's been developed for the treatment of hypertension. Essentially, there are nerves that go to the kidney and nerves from the kidney to the brain, and these can play a role in controlling blood pressure. We take a small catheter, go into the tiny arteries within the kidney. We do a procedure called ablation, which means deliver energy to sort of destroy that nerve. And by affecting that nerve, we lower blood pressure. And if we look at studies, as a general rule, a person will end up on about 1.5 less blood pressure medications with much better blood pressure control. It's not for everyone with hypertension. It's more for people with resistant hypertension on 4 or more, sometimes 3 or more medications.
I wasn't nervous. I knew what the procedure entailed, so my doctor made me feel very secure, and he told me that he's the one that's been doing these procedures mostly over here in the United States. So I was very happy about it. I said, I couldn't wait. Who says that?
She first office visit, she was so happy because finally she had decent blood pressure control. Her blood pressure was not spiking through the roof. So she is sort of like the poster child, just a delightful lady whose blood pressure is finally under reasonable control after all these years.
And I'm happy about that because, you know, when you're sick, you can't always see the light at the end of the tunnel. My family and friends has been reacting to my health. They always want to get me out the house now. And I've been so used to just being in the house or going to the doctors. It's a different thing for me, but I'm trying to engage that and put that in very slowly, and I'll be out there dancing and kicking the foot up one day.
For today, I think the biggest thing is just to get better blood pressure control in a subset of patients who medicines alone aren't working, or that people just have such severe side effects that at least gives us something else to help control the blood pressure.